Welcome to this Anatomy and Physiology Masterclass on the types of bone. This video is designed for those preparing for major health exams. Our session objectives include classifying bones by shape, structure, and development. We will identify the different bone shapes, differentiate between compact and spongy bone, and analyze the clinical significance of bone types. Bones are classified in four main ways: by shape, including long and flat, by microscopic structure, such as compact versus spongy, by development, and by region, distinguishing between axial and appendicular skeletons. There are 206 bones in an adult. Long bones are defined as bones where the length is greater than the width. They function as levers for movement and are weight-bearing. The main parts are the shaft or diaphysis and the ends or epiphysis with the growth plate or metaphysis in between. Examples of long bones include the humerus, radius, and ulna in the upper limb, and the femur, tibia, and fibula in the lower limb. The clavicle is a unique exception, as the only long bone placed horizontally. Our first previous year question asks, which of the following is the only long bone in the body that lies horizontally? The correct answer is C, the clavicle, which is a modified long bone. Short bones are cube-shaped, meaning their length equals their width. Structurally, they are spongy bone covered by a thin layer of compact bone. They provide stability and support with limited motion, and are mainly located in the wrists and ankles. Flat bones are thin, flattened, and slightly curved. Their function is to protect vital organs and provide extensive surfaces for muscle attachment. They feature a sandwich structure called diplo, which is spongy bone between two compact layers. Examples of flat bones include the cranial bones, the sternum and ribs in the thoracic cage, and the scapula. The sternum is clinically important as a common site for bone marrow aspiration due to its accessibility and red marrow content. Question 2 asks, which of the following is the preferred site for bone marrow aspiration in adults? The answer is B, the posterior iliac crest. This is a flat or irregular bone that retains red marrow for hematopoiesis in adulthood. Irregular bones have complex shapes that do not fit into other categories and vary in their composition of compact and spongy bone. Examples include the vertebrae, hip bones, and facial bones like the sphenoid and ethmoid, as well as the calcaneus. Sesamoid bones are small, round bones embedded within tendons, named for their resemblance to sesame seeds. They protect tendons from stress and increase leverage. The largest example is the patella, or kneecap. Previous year question 3 asks, the patella is an example of which type of bone? The answer is B, sesamoid bone, as it develops within the quadriceps femoris tendon. A special type is pneumatic bones, which contain air-filled spaces or sinuses. Their functions include reducing skull weight, aiding voice resonance, and humidifying inhaled air. Examples are the frontal, maxilla, sphenoid, and ethmoid bones. Quick check. Which is the largest sesamoid bone in the body? The answer is the patella. Bones have two types of tissue architecture: compact bone and spongy bone. Compact bone is the dense outer layer, providing strength and protection. Spongy bone is the porous inner layer housing bone marrow and making the bone lightweight. The functional unit of compact bone is the osteon, or Haversian system. It includes the Haversian canal for vessels and nerves, lamellae, which are concentric rings of matrix, and lacunae, which house osteocytes, connected by canaliculi. Question 4 asks, the functional unit of compact bone is known as, the correct option is B, osteon, also known as the Haversian system. Bone marrow is classified as red or yellow. Red bone marrow is responsible for hematopoiesis and is found in the flat bones of adults. Yellow bone marrow primarily stores fat and is located in the medullary cavity of long bones in adults. Question 5 asks, in adults, yellow bone marrow is primarily found in. The answer is C, the medullary cavity of the diaphysis, as red marrow in the long bone shafts is replaced by fatty yellow marrow as we age. In osteoporosis, bone density is lost, disproportionately affecting spongy bone. Irregular bones like the vertebrae, with high spongy bone content, are vulnerable to fractures. Nursing care focuses on fall prevention and promoting calcium and vitamin D intake. For patients with impaired physical mobility due to bone issues, key nursing interventions include assessing neurovascular status using the 5 Ps and maintaining proper alignment. Diet rich in protein, calcium, and vitamin D, along with isometric exercises, is essential. Question 6 asks, which part of the long bone is responsible for growth and length? The answer is B, the epiphyseal plate, located in the metaphysis. Bone development involves two types of ossification. Intramembranous ossification forms bones directly from fibrous membranes, like the flat bones of the skull. Endochondral ossification replaces a cartilage model with bone, as seen in long bones and vertebrae. Question 7 asks, which bone is formed by intramembranous ossification? The correct answer is C, the parietal bone of the skull, which forms directly from a fibrous membrane. Osteomyelitis is a bone infection often caused by staph aureus, commonly occurring at the metaphysis of long bones, which has a rich blood supply. Nursing care requires long-term IV antibiotics, immobilization, and sterile dressing care. Question 8 asks, the membrane covering the outer surface of the bone is called? The correct answer is C, the periosteum. Here are some golden points for your exams. Remember, the longest bone is the femur, the smallest is the stapes. The clavicle is the only horizontal long bone. The functional unit of compact bone is the Haversian system, and diplo refers to the spongy bone in flat skull bones. In summary, bones are classified by shape and structure. Understanding these types is crucial for predicting fracture patterns and knowing the correct sites for clinical procedures like bone marrow aspiration. Clinical conditions like osteoporosis are directly linked to bone anatomy. Thank you for watching this video. Best of luck with your exams.